Let's go ahead and get started. First, of course, we have the disclaimer slide, just letting you know that a number of statements we'll make in the presentation are forward-looking statements. This industry that we're involved in is an AI-driven technology industry that's revolutionizing a very large industry. So Tony, if you could talk a little bit about, give the attendees a little of a view of iRemedy from the 50,000-foot level.
Absolutely. Well, good afternoon, everybody. It's great to share a little time with you to talk about the iRemedy story. As Gary said, we're just super excited about all the progress we've made and all the opportunity in the future, and we appreciate your being here today. So, you know, we have quite a background in healthcare, and one of the things that we learned is just the immense complexity of the medical supply business. And we're going to talk a little bit about that today, but it's you know, it's a life and death supply chain. Like, it needs to work in a very reliable way to protect all of our lives and to keep us healthy, but it also needs to be affordable, because that's part of the access of healthcare. If it's outrageously expensive, then we can't deliver the needed services and products to the people in this country. So it's very complex, and we've been working on a new approach to really revolutionize that industry. And you know, started going after this with an AI-driven technology paradigm, if you will, a number of years ago. It seems like AI is the talk of everything today, but we really started our process of going down this road, I would guess, about 4 or 5 years ago. So it's a $130 billion industry, at least the segment that we're focused on. And our goal is to develop a very smart catalog, the smartest catalog of healthcare products in the world, and a very unique and powerful procurement marketplace to give people access to that catalog.
A little bit about us. We've been in this business for over 15 years in healthcare supply, and we've created a trusted and reliable relationship with quite a few of the main vendors, product companies in this space. And we've also been involved in working with government agencies, hospitals, physicians, and consumers, working through iRemedy to get the medical supplies that they need. And our business model is to guaranteed access to verified supplies directly from established manufacturing distributors, because there's a lot of medical products out there, but we put them into our catalog and guarantee the authenticity of the products and so forth. And we, doing so, bypass the supply chain bottlenecks that really became evident over the last couple of years, certainly during the pandemic with shortage of products. And by the way, that continues to be the case today. And taking a fresh approach, as Tony mentioned, an AI-driven approach to this industry that's been around for quite a long time, we've leading the company with healthcare people and technology people that I'm going to share a little bit about our background with our leadership team now. Of course, beginning with my brother Tony, who is the CEO of the company. Tony is a lifelong technologist, a software developer. He's a healthcare consultant and author. He's worked with a couple of hundred different hospitals across the country. So he has a background very extensively in the world of healthcare, particularly at the high end in hospitals. He is the founder and CEO of Agency One. We sold that to AMS, or sold that to CNA Insurance Company, and then grew that to be the largest software company in the insurance industry. Tony's authored one book that's already been published, just now completing the second book on healthcare in America. And that book, by the way, will be coming out very shortly. We expect it out this summer. And Tony is also the founder and CEO of MetaNext, where we did an IPO on the NASDAQ. Jim Harding is our Chief Technology Officer. Prior to joining iRemedy, Jim was VP of Technology at Amazon, where he built and launched the Amazon Marketplace. When he joined Amazon, at that point, they were an online bookstore. Bezos said, I want to create this new thing called a marketplace. And Jim said, well, we have to invent the technology to do that. So Jim actually invented that technology and holds a patent for that. Jim also started 2 different technology companies. He sold both of those to Amazon. That's how he got to know Bezos so well. He was the founder and chief technology officer of Multiscale. That was a healthcare technology company working with hospitals on the West Coast. That's how we met Jim quite a few years ago. And finally, he was one of the creators of PC-DOS, which was licensed to Microsoft. So Jim has an impressive background both in technology development and being involved at a couple of very, very large, successful technology companies right from the beginning. Tony, talk to us a little bit about the medical supply industry and the market that we're going after.
Absolutely. So, I comment on the fact that it's a massive industry. That's pretty obvious. Healthcare is one of the biggest industries in the United States. The medical supply industry includes everything from medical devices, pharmaceutical drugs, and what we sometimes refer to as med-surg supplies, things like, gloves and gowns and needles and syringes, the consumables that are used every day in hospitals, doctors' offices, dentists, surgery centers, and so forth. So it's a very big, very complex industry upon which our very lives depend. And, we are focused on a particular segment of that industry, particularly what we refer to as the middle market, large clinics and surgery centers, although we've served tens of thousands of customers from hospitals on down to individual doctors and dental offices.
And we look at the medical supply industry, the view at a very high level. As Tony mentioned, it's a very large market, well, 240 billion when you add in pharmaceuticals and drugs and so forth. But that's just the US medical supply market. There's over 4,000 hospitals, close to 10,000 surgery centers, and probably, as a matter of fact, it's probably exceeded 10,000 now because they are opening quite frequently. And over a quarter of a million about a quarter of a million physician offices, in addition to all of the other participants in the world of healthcare. So labs, urgent care centers, so forth, the imaging centers. There's a lot of different institutions involved in the world of healthcare, as we all know, and they all use medical supplies. And up until now, they've been kind of left up into their own devices as how do I get those medical devices? There's medical supplies. I mean, there's just no uniform way in order to do that. But if we were to drill down a little bit further, Tony, talk to us a little bit about specifically the healthcare supplies market as we see it.
Absolutely, because there's been some problems, and we all experienced that over the last couple of years. But Gary, as you commented, this has really been going on for about a decade. First off, we talk about all the time, kids, very big market, 100 billion, 200 billion. It depends on how you sort of carve that out in drugs versus devices versus supplies. We're focused on about a $100 billion market of the broader healthcare market. The industry, though, has for decades really suffered from a lack of price transparency and fairness. And you may hear these discussions taking place, but I think everybody's familiar with the idea is it's just hard to understand what do things really cost. The simplest way I can describe that is if you take 100 doctors and you put them in a room and you ask them, what do you pay for this particular item? You're going to get possibly 100 different answers. Now that just has to do with the unfairness. It's very discretionary, lots of different deals, things that just doesn't make sense. But it's just the way the industry has developed and been regulated and built through layers and layers of resellers and distributors and manufacturers and GPOs and so forth. So no price transparency and really an unfair pricing system. Now there have been data inaccuracies and product shortfalls for decades. There's been many cases of drugs becoming unavailable in key medical supplies, devices, and so forth. That's really driven, candidly, by the globalization movement that we're now all so familiar with. But over the last 30 or 40 years, like everything else, the manufacturing of most medical supplies and drugs has moved overseas, in fact, mostly to Asia, mostly to China. So about 90% of our drugs that we use every day here in the United States, in fact, are made overseas. And that just creates a fragile and problematic supply chain. Something we're very passionate about helping to support a change around that. The industry just have layers upon layers of intermediaries, and that creates a lot of cost. But the end user, whether it's a hospital or a doctor or a government agency or a dentist or a large surgery center, they really have no control over this supply chain, and they just have to take what's delivered to them. About 40% of the cost of medical supplies is in this sort of sales and distribution system.
So it's a large, complicated market, as Tony said. One of the main, I guess, problems that we've heard, particularly over the last number of years, number one is the uneven or unfair pricing, if you will. Take 100 different doctors with 100 different pricing. And secondly is the complexity of it. A lot of the people we talk to, they're just looking for a simpler system. They're all used to going online and making a simple purchase. So Tony, talk to us a little bit about the issues that we talk about, go a little layer deeper on hidden cost and some of the global supply chain issues that you spoke about.
Yeah, it's one of those things that probably an unintended consequence of the globalization movement. 30, 40, 50 years ago, people started looking for a lower cost way to produce goods. They naturally went to Asia, to other places around the world. But the side effect of that was it became very complex. The other thing that we'll talk about here in a moment, but the large distributors they've been around a long time. These are very important companies. They're important to the security of the United States, but they've been in business for 100 years or more. So no, they're not really built on a culture of modern AI thinking and disruption and new models and new approaches. So you've got these old companies dealing with a globalized supply chain that's just flat out failing. And as a result, you're getting these very high costs, lots of product shortages, and just a ton of negative customer experiences.
And we certainly saw that, exemplified over the last couple of years as we went through the pandemic, and it seems to be continuing on. So just a great deal of frustration from the buyers out there. So if we were to take it a step further and look at exactly what does our artificial intelligence do? What does that mean when we're talking about an AI-powered supply chain?
Yeah, and what happened was years ago, we were doing consulting work at hospitals. We worked with about 600 hospitals around the United States at the C-suite level, and we're dealing with medical supply challenges. Being technologists, we thought, hey, there's got to be a better way to use technology to build a better approach. And we came up with the idea of developing a healthcare marketplace. At that point, began working with Jim Harding. And of course, Jim is, first off, a great friend, a great guy, person that loves to do the right thing, wants to deliver, a service to humanity. But he's also one of the great thinkers and one of the leaders in marketplace inventions. I mean, he really was the leader in developing the Amazon reseller marketplace. So I went to Jim and said, hey, we got this problem. How do we solve it? And he was in the healthcare world at that point. He understood the immensity and complexity of the problem. And we began to discuss the fact that, well, the good news is AI is finally becoming powerful enough and computer technology that we could address the problem with some innovative technology. So the first thing that we did was develop some, we kind of call them digital agents, but effectively it turns the internet into a global products database. So we're able to go out all over the world. Now remember, most medical supplies are manufactured somewhere else. But they are all certified through the FDA here in the United States. So there's a roadmap that you can find your way on the internet, and you can find all this product data. And we managed to develop some highly proprietary, patent-protected technology that allows us to effectively, the simplest way is to say, turn the internet into a database. And then we use that for the next item to develop what we call the UHMPC, the Universal Health and Medical Product Catalog. this is very much a work in progress. Our vision is to have the smartest, largest healthcare product catalog in the world. That's, obviously you're going to work on that forever, but we want to use AI to build this really rich catalog of data about healthcare products available here in the United States, but sourced around the world. And that's one of our key goals. We currently have about 500,000 products available in our UHMPC. Our goal is to have 1 million by the year end and just keep growing from there. The next thing, though, is that we developed what we refer to as digital agents. Some people call them digital doppelgangers because they can learn what humans do and then replicate that activity. So when you hear all this talk about ChatGPT, there's amazing things going on there. That's about information and text and content. It's pretty incredible. And in fact, we may incorporate some of that into our catalog enrichment back over to the UHMPC. But in order to bring efficiency to the supply chain, we developed these AI agents, not about information, but agents that do things. And these agents can go out and monitor pricing, monitor availability, and actually process orders on behalf of clients and suppliers and track and report supply chain details. So this ability to create these agents is what ultimately gives us scale. We can solve activities and problems that maybe you could have done with people, but frankly, you'd just have to have too many people. You'd have to have 1,000 people to solve the problem, which is unmanageable, unavailable, and unaffordable. And so we're able to do it now, and we're just beginning. We have this in place and working today, but we're really beginning the scale process of finding new ways to apply this technology.
I know a lot of people sometimes are intimidated when they hear AI and artificial intelligence and so forth, but when you think of it, the truest concept of it is, to Tony's point, is it can do the work of thousands or millions of people using these agents. And that's important when you get into the world of medical supplies because number one, there's millions of SKUs out there. And number two, there's all this different pricing with GPOs and distribution, and there's literally probably billions of data points. And so up until now, it's a part of the industry that hadn't been really managed. And we saw what happened, with the pandemic when that all came about in early 2020. That's the ramifications of not being able to manage that. So Tony, if you could talk, this is kind of an interesting topic. I know you and Jim talk about it quite a bit, but the human workforce shortage and what does that mean in the world of medical supplies?
Yeah, you see this weird situation that we have going on right now. We have inflation and a possible recession, but we still kind of have this full employment economy. And it just has to do with the fact that we don't have enough human resource in this country to deal with all the information and activities that are required. Jim has a really interesting analysis and story, and it's in our Tech Talk. And there's links to our Tech Talk available, and you could ask for that, we'd send it to you. But Jim and I spent a half hour, an hour here a week or two ago talking about these issues. And he does a great job of explaining how, the number of computers in the world has gone through the roof, if you will, and now you have multiple computers per human, right? There's just not enough people to keep up with the online data and information. And, we're not the information age, we're the, over information age. We have like too much information. There's simply not enough people. So what this technology does is it creates digital agents. Now it's very unique in our world because we have strong beliefs about AI and how we don't want to see AI kind of run amok. Our AI only works on behalf of people and does activities that the people would do under the control of the individual people. So we take a person who's working and we replicate them, and the agents essentially work for that individual to help them replicate their work. So it's a way of, meeting the needs and leveraging our current workforce to allow them to manage more data and solve more problems through action.
So in the processing, talk to us a little bit about the our driving initiatives, if you will, the core principles that we have behind iRemedy. What is our mission?
Right. So one is transparent pricing, no black boxes. Why? It is. You have this complex problem. Doctors, hospitals, they might be buying thousands, millions of items. Prices constantly changing, but it's all sort of hidden. And we take that away, and we manage that, and we make the pricing transparent. So we would make it fair. Rule number one. Rule two is to make it easy. So, the buyers today are really the millennials, and other people are saying, hey, I don't want a sales rep to call me. I certainly don't want to use a fax. I don't want to get on the phone and order a supply. I want to order it online. I'm an Amazonian. I've been buying online with Amazon for the last 20 years. Why can't I buy all my medical supplies, regardless of the complexity? I want that same convenience and ease. Now, in healthcare, as Gary mentioned at the beginning of our talk today, we have to understand the provenance of every product. We can't just have this open marketplace where everybody can sell whatever they want, because counterfeit products would be deadly in the healthcare industry. You can't have that. So you have to have a controlled supply chain, and it has to have multiple suppliers and vendors and distributors who are all great companies. These aren't really companies we compete with so much, but we feel we enhance. But you have to have access to all of them in an easy and convenient way. Our step number two, easy ordering. And then the third is constant supply monitoring. So this is the big deal. Our technology monitors availability, sourcing, and pricing just constantly on behalf of clients, because we know what those clients are buying. So we're tracking what they're buying, and we're making sure that what they need is available when they need it. And that's a 24/7 working in the background kind of thing. It's like having an army of people working for you all the time, making sure that when you need something, we know where that product is and we know how to get it.
Exactly. This is, I think, a very informative slide. What makes iRemedy different from others? And I think there's an interesting story here, Tony, if you can kind of walk us through this.
Yeah, the typical medical supplier in the United States is over 100 years old, and they are great companies, and they're important companies in the United States. Like, we rely upon these big distributors, but they were started before most homes had electricity and TVs, before IBM even built their first computer. So we're more the we draw this graphic to sort of illustrate, we're the modern era. We came about after Tesla. We're the most contemporary thinkers and technologists, we believe, anyhow, or our goal is to be that in this medical supply industry. It's big, it's complex, it's getting more complicated and arguably worse every day because of globalization. And we need just an absolute state-of-the-art approach. So that's where we're coming from. And it's not about necessarily what we have today, although we think we have some great technologies. It's about what's our culture and how are we, pressing forward to do great things, to lead the industry in the next generation or the next 100 years.
And lead us through the buying process, because I think this is very important. As you mentioned, you've got Amazonians, but a lot of Gen Z and millennials and so forth now that are in doctors' offices and surgery centers, they're actually doing the ordering of supplies.
Yeah, because that I tell that story about if you had 100 doctors in a room and you asked them what they paid for a particular item, and I said 100, they'd say 100 different prices. Well, actually, they would say they have no idea because they don't do the buying. Okay, the actual answer is there's some either procurement person, more likely, depending on the size of the institution, a nurse or another health practitioner that's helping out, or an administrator, most likely an administrator that does the software, that does the actual buying. So they can go into our catalog, and we're monitoring all these catalogs, all these prices, and they can easily and conveniently find what they need. Now, if we don't have it, they can effectively, we'll learn that, we'll know that from their request. And then our robots, if you will, we like to call them our digital agents, but they'll go search the world looking for that item and report back to us so we can report back to our client when that item is available. So that's step two. And then third is when we do have now the right product for the right customer at the right time, we can analyze the details that are very unique to the healthcare industry. Allocation. Is that product available by the distributor for that client at this time, and can it be delivered? Is that price, the GPO, the group purchase order contracted price for that customer at that time properly? Is there some sort of licensing requirement? Is it a drug, for example, that requires a DEA license? And our systems will analyze that and make sure everything is lined up. And then simply we can do a purchase. And then finally, we can report. And we can go back to that client and say, this is how often you were in compliance with your GPO contracts. This is how often you paid more than you should have for a particular product. Here are some products that would have worked as alternatives to the products you bought. So there's a lot of reporting opportunity. Once again, going back to the idea of a smart catalog, it's all about trying to bring intelligence and learning, machine learning into this problem. And doing it at scale for both the very large clients, but also for the individual small clients. We're big believers in small business. I think this country is built on entrepreneurship and small business, and we want to bring that value right down to that individual doctor's office. At the end of the day, healthcare is about a doctor and a patient in a room together, and we want to do everything we can to help support that sort of local instance of the healthcare market.
Exactly. So we believe that the time for change is now. And there's never been a better time to empower patients and healthcare providers and doctors. The service is going to make their lives easier. And literally, this saves lives. And we saw evidence of that certainly over the last couple of years. And we want to let everybody know that when you invest in iRemedy, you're investing in the future of healthcare. Tony and I have a very optimistic future, the vision, if you will, of healthcare in the United States. And I know a lot of people look at it as glasses half full or empty. And we look at it in terms of there's never been a more exciting time. The Human Genome Project has been mapped, and you've got new treatments and drugs and all these wonderful things happening. And what we want to do is enable that and accelerate that, and then at the same time deal with the out-of-run the inflationary costs that are built into these legacy systems, if you will. So if we can do it better, faster, cheaper, easier, in a more fair fashion, everybody wins. And it's important, I think, too. And I think, socially that, when we make investments in the companies that we follow, you look at terms of, what mission are they providing and how they can make this world a better place. And certainly iRemedy, that's part of our mission. And for all of those healthcare professionals, it'd be great to, be an owner in the be an owner in the company that you purchase supplies from. So it truly becomes an effort by everybody, lifting together. Our customer reviews, Tony mentioned, we've had over 10,000 customer ratings. We rank at 4.7 stars, which is fantastic. I think we've less than 1% of low ratings over that last 5 to 7 years, and every single category for delivery time and would buy again, to recommend, so forth. So we know that this is the right model. And now what we want to do is continue to further development and move it out to the country. So in summary, we believe that the UHMPC, the Universal Health and Medical Products Catalog, is the largest and smartest medical products catalog on the internet. It's going to have two purposes, as Tony mentioned. Number one, of course, to be able to source medical supplies and put it into an easy to access catalog that people can order from. And number two is to find those products. And as globalization continues to take place, and you've got manufacturing taking place and in different countries, now there's a reshoring activity that iRemedy is very involved in, bringing some of that manufacturing back to the United States. We become the perfect conduit for that. We've got a highly proprietary marketplace technology system that was developed by the creator of Amazon's marketplace. And Jim believes this is the most significant development that he's ever been involved in. Our team is a track record of acquisitions as well as a public offering. So we look at the future as being very, very bright for all of the investors at iRemedy. Our revenues exceeded $50 million in 2022. Those are the total sales going through the company. And by the way, our business model is that of a marketplace. So we make approximately 15% of all transactions going through the marketplace. But the good news is our business is extremely scalable in that the majority of the products, we don't have to take ownership of any of them. We're a data company. We move those orders out to the traditional companies that in turn physically deliver those supplies. In other words, we can go from 50 million to 100 million to a billion using the technology. We're very, very scalable, as they say. It's a $100 billion market. We believe it's the most important market in the United States, and one that's been underserved. There's been no significant, radical change in terms of technology in the healthcare and the medical supply market, as happening in every other market. So, in keeping with the times, and my social media director said that I had to put this slide up for you. So scan this QR code with your phone's camera, and it'll actually take you to a link for more information on iRemedy investing. And certainly, if you have any questions, feel free to reach out to me directly. You can use my Calendly appointment link there too, so you can literally go on my calendar at any point in time if you have any questions or if you'd like to ask any questions directly of me. I want to thank you very much, everybody, for attending this afternoon. We appreciate it. We believe with your help, we're going to change how healthcare and medical supplies are literally delivered in America. We're excited about what we're doing, and we're very thankful to have you as interested participants. Thanks, everybody. Hope spring is launched fully in your part of the world, and we'll look forward to hearing from you. Thank you very much. Thanks, Tony.
Thank you.